Hello, and welcome to Connecting Tucson with Jaime Overturf, broadcasting from the Tucson Business Channel, a division of Mark Bishop Media, situated in the Stewart Title corporate offices on Broadway. Connecting Tucson is all about connecting our community, local businesses, and organizations to help our community grow and thrive. Today we are talking to Dr. Kristin Makinajyan, the owner of Tucson Medical Home Health, located here in Tucson, Arizona. Kristin is an immigrant from Armenia, came to the U.S. when she was 16 years old. After graduating high school in Pasadena, California, she began her nursing school, graduating from LAS USC School of Nursing. It was challenging but an eye-opening experience for her, but she did not stop there. She started working at the county hospital as an ICU nurse and later on discovered the wonderful world of home health. She continued to obtain her master's in nursing and education as well as a doctorate in nursing. Thank you so much for coming on the show with us today, Kristin, and sharing a little bit about you and your business. I'm super excited. I always like to get the icebreaker. Let's let our listeners know a little bit more about you and your background and what brought you to the wonderful world of home health, I guess.
Hi, Jaime. I am a nurse,
right,
first and foremost, and I have decided to continue and follow my dream of becoming a nurse and advancing my career and becoming who I am today. Once I began studying it and I began working in it and I began to see how wonderful it is and what can a nurse do to make someone's life better and a community's life better. And so when I finished my school and I started working in the ICU at the county hospital, it was heartbreaking because I was working with people who were either shot or had car accidents or were stabbed, and most of them died, and it was just really, really sad to see all that.
That is a tough unit. ICU is a very tough unit.
It was difficult, and so I knew that this was not emotionally possible for me to continue. So I started looking into other avenues, and one of the interesting atmospheres I found was the home health. Mm-hmm. So I started working with elderly. After work, I would just go see some elderly patients at home who needed some help. And I discovered how much I love elderly people, how much I love helping them, and how grateful they are, and how much they make me feel important in their lives, and I make them feel, well and secure and all that. And so that's how I discovered home health. Did that for about 20 years, and then figured out that this is really my calling. So I wanted to go ahead and open up my own place. And
you knew you wanted to help people. You just didn't want to do it in one of the most traumatic settings ever. And I do agree. I do think that the elderly today, especially in the U.S., they kind of have the raw end of the deal, in my opinion, when it comes to some things. But what is home health?
So home health services is a service provided to those who are homebound, and it's covered by most of the insurances, mm-hmm. and it is prescribed by the doctor
I didn't know that.
Mm-hmm, or a provider like a nurse practitioner or a physician assistant, where a nurse and or physical therapy, occupational therapy, speech therapy, a social worker can visit people at home providing specific treatments. It could go from wound care to IV antibiotic infusions to injections to managing of medications to therapy working with balance and strengthening and things like that. It's a wonderful way of keeping people at home instead of the hospital, because being in a hospital costs a lot to mm-hmm. the insurances. And so that's why home health was created to offset that cost and to lower the stay in the hospital. And people always do better and rehabilitate better at home in their own environment, in the familiar place with their own family members, rather than in a hospital or a SNF. A SNF meaning convalescent hospital.
Yeah,
sorry.
No, that's okay. I got what you're saying because I do Medicare as well. So
yes.
I got you, but sometimes I get into that acronyms as well. I was going to ask you what a SNF was, but you got it already. So, so how does one, I guess, you said you get prescribed by a doctor or a nurse practitioner. How does that come about for home health? And I'm asking because I think there's different types of home health. There might be a permanent one, whether you're going for them multiple times, or perhaps maybe there was an accident afterwards and then you're just there for a short amount of time, correct? It can be all of those, or...
So there are no rules or regulations in regards to that. As long as the patient needs it and as long as the doctor thinks that it is appropriate, then you can continue go. However, there are some rules and limitations depending on what the patient is doing and how well they're getting. If the patient is gotten well enough to start going to the doctor's office, then we can remove ourselves and help some other ones who are homebound. Excellent.
Yeah, because some people think of home health, maybe it's like, when I was looking for it, one of the misconceptions that I saw was like home health was like hospice care. And I don't know if that's really what that is. You are more there to help them get rehabilitated and get them back on their feet and just making sure that things are going correct.
Yes. Hospice is a different philosophy, and they're helping people tremendously, and they're helping them once the patient is at the end of their lives and they are ready to move to the next level, and hospice does a fantastic job.
They do.
Helping them move over that. Home health is helping people graduate to better care, better health, and become more independent and dance and climb rocks and things like that.
Excellent. So what got you interested in home health, and specifically home health here in Tucson, Arizona, because you were in California?
So when I was working in California, I found that there was a lot of bureaucracy involved, a lot of things that were not really aligned with my mentality and my mission and my belief system, my vision. And so I didn't want to be a part of that, and I wanted to do something where I can reach out to people who actually needed the help. And so my husband, who is economics and statistics graduate, he said, why don't I run some numbers and see who needs help, and then maybe we can move there and see what we can do. So he ran some numbers, and he told me that one of the west side places in the country that do need some help with healthcare is Tucson. And it's not only because they don't have enough home healths out there to address all these people, it's also because the home healths that are there lack enough clinicians. And so he said, maybe we can address both problems. Maybe we can change the way that we treat clinicians so that the clinicians stay, and maybe we can make it a better place for everybody.
Excellent. I do remember your husband's a very numbers-driven guy. I am too, obviously, with that. So tell us about Tucson Medical Home Health, and what is your goal for the company and the community?
So Tucson Medical Home Health was created and is still, moving towards that goal, is created to serve the community. We are there to address the issues that the patients have, health issues that the patients have. We are there to address the issues that the clinicians have. We are there to address the issues that the doctors and the providers and the hospitals and the discharge planners have. And we are there to make it smoother for everyone. So what do I mean by that? If a doctor calls us and says, hey, I have a patient that needs to be seen in the next 2 hours, can you make that happen? Normally, most places you call would say, well, we need a 24 to 48-hour turnout. And they have the right. That's the law. That's the regulation. But we want to make a difference, because if someone needs us in the next couple of hours, then it's serious. Laws and regulations are great to follow, but sometimes we have to look past them and we have to do what's needed.
Needed and right, and think sometimes with your heart. I think sometimes we forget about that in our community because we get so tied up in, I can't do this because that's what that guideline says.
Right.
And yes, they're there for a reason, and I do get that, but I do appreciate that. So when you say you're addressing issues, and I know we had just touched on this a little bit, and when you say that I can be there in 2 hours, what does that look like?
So luckily we have amazing staff, just amazing. Every single one of the people who works with us, be it a nurse or a physical therapist, they're so compassionate and they're so patient driven and they want to do the right thing. All it is just a phone call. Can you please go see a patient here? And most of the time the answer is yes. But in very rare situations when everybody's tied up and nobody can go, then I go because I'm a nurse.
There you go. And I bet you love every minute of it too, don't
I
you?
I do. I love patients.
I know. Do you work with do you work with hospitals, doctors' offices? Is there specific ones where you work with, or do you take them all?
We try to work with everyone. We try to work with all the hospitals, not just here in Tucson, but also in Phoenix, because some of the people will be in the hospital in Phoenix, and they will be discharged home to Tucson, so they'll reach out to us. We also work with some of the hospitals that are nationwide, and patients' home happen to be in Tucson, so they'll be discharged from one or another hospital somewhere else, and then they'll come home and they'll reach out to us for that. Excellent. We work with a lot of the doctors in the community. We work with pharmacies, like infusion pharmacies. Mm-hmm. We work with convalescent homes and rehab centers. We work with assisted livings, and we work with care homes.
So pretty much everything.
Everything. We try.
Everything. Yeah, I do know that in doing some of my research, some home healths won't go with a couple of, some of the other like hospitals. Maybe they'll focus more on a TMC or that type of area, but you're doing everything, which is phenomenal. So
our goal is to make sure that everyone has an opportunity to be well taken care of. And we don't really limit our choices of the referral sources or where the patients live. If it's doable, we'll do it.
Excellent. Very impressive. What are some of the products and services that Tucson Medical Home Health offers?
So we don't really sell anything. We only provide the actual skills, mm-hmm. which are nursing, physical therapy, occupational therapy, speech therapy, social work. And however, if a patient needs some equipment to be ordered, then we'll help them out. We don't have any equipment to give to them, but we will take the doctor's order and we will contact the insurance, we will contact the supplier, and we will kind of coordinate all of that so that the patients get whatever they need. And it could range from anything like a walker, cane, or a wheelchair, or anything that they may need, to make it more safe and comfortable at home.
Excellent. So do you only cover like medical services? What if the patient needs caregiving services?
So we do not provide caregiving services, and medical insurance does not cover that service. However, there are some caregiving companies here around Tucson that have been great. And we do give people some names that they can call around and get some quotes and talk to them. Sometimes there is an insurance, I believe it's a life insurance, that may cover some of those services for patients. Mm-hmm. And that's fantastic if they have that, because then at their end of life, when they do need this care, this is an incredible opportunity for them to have that.
Yes, there's a lot of different life insurance policies that offer that, long-term insurance.
Long-term, yeah.
Some universal policies out there also do that. So there's just a lot of endorsements. Talk to your insurance agent, people.
Yes, her name is Jaime.
So do you provide any personal care, and what does that look like?
No, so personal care would be quote-unquote custodial care, which is also not covered by medical insurance. However, if someone came home and they needed training on personal care, then our occupational therapists will train them and or their caregivers or loved ones how to do it. So our job is to make you independent of self-care or help your family learn how to take care of you so that when we're not there, you can do this. And so that's where the occupational therapies Shining comes in, and they do an excellent job.
Above and beyond, as always.
Above and beyond.
So, this is a broad question, but what areas do you cover?
So we found that a lot of the outside of Tucson needs a lot of attention in healthcare, only because of no available clinicians. And so I have gone as far as Mammoth on the north side. I have gone as far as Rio Rico in the southwest side. I've gone to Sierra Vista. And, we basically, if it's drivable, then we'll do it. But there is a limit. We can't go beyond 100 miles from our office.
Yeah, you have to put a restraining on something.
A little bit.
Just a little bit. So you kind of do a 100-mile radius within the greater Tucson area would probably be a good way to put it.
Right.
And you could potentially go up to Phoenix because that's a little over 100 miles, but that's...
It's 126 miles, and the regulations of Medicare say if there is no available home health in that area, then it is okay to cover that area. However, Phoenix is a metropolitan city, and it has more than enough home healths there, so there's really no need for us to try to cover that.
Yeah,
it's a better outcome for everyone if we try to cover Nogales or Rio Rico or Tubac, where there is actually difficulty trying to staff that.
So you really don't have an initial consultation. You start when a doctor calls you, correct?
Yes.
And how does that look like? For a patient like me, let's say, you can get home health. What does that look like for me?
So the doctor, either at his office or her office, or the doctor in the hospital will say, you need some help with the home health, and the reasons are because you're unsteady on your feet, you may fall when you get home, or you have a wound that needs attention, or all these medications are new for you and you don't know what you're doing, and you need someone to kind of help you with that.
Medications are a scary thing.
Scary, isn't it? And you have labs that are out of whack, and we need to check them once a week, so someone needs to come show those to you. So the doctor will decide specifically why they want us in there. And once they send us the prescription with the reason why they want us there, then a nurse will go out and will assess the patient, and will not only assess that particular issue, but will assess everything else, like the home dynamics, to see if the patient has access to a refrigerator with safe food and clean environment, and a home where it's safe for the patients to stay, and things like that. And also we'll see if there's any need for any other resources, like any money that they are lacking, or they need some referrals to. So social worker will get involved with that. And we talked about the showers and personal care. If that's an issue, then an occupational therapist will get involved. So it's a variety of levels of things. Fortunately, nurses are trained to recognize all of those issues, not just the medical problems, but all the social problems, physical problems. And so and home health provides that opportunity to have you sit down and be one-on-one with the patient and the family to figure out what can we do to make your transition from an institution to home easier and more productive.
Excellent. There's a lot to home health that I did not realize. I was confusing home health before I started doing some research for some other things you like overnight stay care, or, I learned a lot. It was eye-opening. What sets you apart from other home health care carriers or providers, and why should they choose Tucson Home Health? Because I know sometimes the patients may have an option to say, I want to use this person over that person.
Patients always have the option. That's the first choice. The patients always get asked, where would you like to go? And a lot of the patients have preference because they've had a positive experience in the past, and that's great. What sets us apart is that we're local, we're small, we work with people, and we bend backwards for everyone. And
we have a phenomenal staff.
We do, and we'll do anything that's possible to do to make your life easier.
Exactly. And What should, in all reality, let's just say there could be some bad ones out there. There's probably some good ones. What should someone look for a home health care provider?
So communication is the number one.
Okay.
It is very, very important for the home health to be able to communicate with the patient, with the patient's family, with the patient's doctor, or doctors. Sometimes there are several that are involved. And it is important to this communication to be recorded somewhere so that you can go back and forth with that. You are dealing with some people who may have sundowners, dementia, and so that's why it's important to communicate and record all of that. And it's important. And one of the other excellent characteristics of a home health is responsiveness. If you called someone and you heard back within a few hours, then they're great. But if you called and for a week no one called you back, then there's a problem.
Right. And it is the patient's choice. That is correct. So if they find themselves with a home care provider that does not mesh with them, they can always have their doctor switch them, correct?
Absolutely. And it's they can just say, this didn't work out, would you recommend another one? Or they can research their own.
I think some people forget that they can do that, and then they have such a terrible experience with something that should be so positive. So I always am an advocate. If you don't like what you're getting, speak up and let's see if we can't make it better. So.
I do want to say that it is one thing about the home healths in general is that it may or may not be the home health. It may be just the person you're dealing with, like the specific clinician, and people sometimes don't click.
Yeah.
And if the experience is not good, reach out to the office and see if the office can switch the clinician, and that way you'll have a better experience.
Excellent. Very, very interesting. If you are just tuning in, you are listening to Connecting Tucson with Jaime, where we focus on connecting our community, local businesses, and organizations to help our community grow and thrive. As your local insurance professional for all insurance needs, I know how important it is to make new and lasting connections in our own community. You never know how a connection is going to create a spark or pull you in a direct or unique direction. If you are a small business owner or involved in a community project and you just want to be featured on the show, please feel free to give me a call. All of my information is on the Tucson Business Channel. Just click on Connecting Tucson with Jaime. I'd love to hear from you. Today we are talking with Dr. Kristin Makinajyan, owner of Tucson Medical Home Health. And you mentioned before you were working with clinicians and to services and who really needs it. How do you select these clinicians that help you in your business?
So most of the time, the clinicians that happen to come through our doors are referred by other clinicians. It's a word of mouth. I have not even had a chance to put out an ad for any clinicians, and we've been open for a year and we have zero turnover.
Yes, that's what I said. Your staff is phenomenal. So is there a select criteria that you're looking for some clinicians?
We will attempt to work with anybody.
Okay.
But, and I have so much respect for all the professions, nurses, physical therapists, that I will work with them. I will treat them with very high respect. And in return, they treat us the same way. And they do everything that they're supposed to do the right way. I mean, I'm not too sure. Maybe we just got lucky, but every single one is a gem, and I wouldn't trade them for anybody else.
Oh my goodness, that's phenomenal. I have my staff has been with me since I first opened, so I am a firm believer in treating someone how you would like to be treated, and then they're going to reciprocate that for you. So we talked about insurance, obviously. What if someone doesn't have insurance? Can they still benefit from your services, and are there other options for payments? How do you work with them?
So there are some instances where we get hired for just cash money, and that is not necessarily by the patients, but by some other entities such as a law office or something. And if the medical care needs to be rendered because of some lawsuit, then that's how they would get us involved, or we get hired by workman's comp for something, and they would just reimburse us. And so those are not necessarily insurance driven. They're more checks that are provided to us for our services. There are some instances where people just don't have the money and they need the care. And so I'll go out and see those patients, and I'll take care of them, and we won't charge them.
Oh, that's so nice.
And sometimes it's just it's the difficulty of getting the insurance to be on board with us. It's just people who just don't have insurance, and they don't have the capacity to get insurance, and their diagnosis is very poor. And so we do provide about 5% of our income to give out some free care.
That is phenomenal. That's phenomenal work. And I am not sure I am happy with the system that we have here, but you and I have spoken on that at length. I find it sad that some people cannot afford insurance, and it should be affordable to people, in my opinion. So we'll take that with a grain of salt. What do you like best about what you do?
Helping people. It really gives me grand satisfaction just to look on the face of a person who knows how to self-care and who is more comfortable with what's going on. And they say, if before you came here, I had no idea what was happening. I just wanted to go back to the hospital. And now that you're here, I figured you helped me figure this out, and I can do this. It's not that bad.
Where they have that light bulb, like, yes, I can do this. They have the confidence to make it happen. I think that is the most important, because when you're not confident, you tend to just think, I don't need it, and then just go without it.
But yeah, you see that spark in their eye, and that makes up the whole effort that you put in.
I can tell you're so passionate about what you do, and I'm glad you got out of the ICU and are now helping the people that really, I think, need it, and just bringing joy and light to these people.
Right.
What are some challenges that the business is facing now, if any, and what, if as anything, as a community, can we do to help?
So some of the challenges, and this may not be specifically about our business, but just in general about the industry, is the healthcare insurance and the lack thereof. A lot of the people who do have insurance coverage through Safe Home Access or whatnot, they believe they have coverage of one or another service, but when the actual time comes and the service needs to be rendered, they get denied. Ooh. And it's sad. It breaks my heart, because these people go home thinking that they're going to get care, and they don't. One instance like that happened about 2 or 3 days ago. We had a patient that needed to be taken care of for wound care, and the wound was complicated, and the insurance was given the opportunity to give us authorization, and they went back and forth for a week and wouldn't approve it. And finally, the medical director got involved, and finally he also said no. But the hospital sent the patient home thinking that we're going to take care of the patient. Patient's at home thinking that she's going to get a nurse and the insurance. Meanwhile, we took the entire week fighting with this person, that person for that visit. And then we got denied. So. And
then how is she he gonna help with the wound health care during the time when you're trying to fight back and forth?
So it was 5:00 at night when I got the fax from Access saying we're denying your services because we found another agency that will take care of the patient. Right. And I called that other agency, and they said, no, we're not really taking care of the patient. So I got into my car, got some wound care supplies, drove out to the reservation, sat there with her and her sister and her mom, and said, okay, so here's what we're going to do, and this is how you do this.
That's why I wanted to get you on here, to help share the word and get it all out there. And speaking of share the word, you do some, community engagement here right in Tucson, Arizona. Tell us about that.
So it all started with our dog. We have
that's the best stories, how it all started with my dog.
So we have a very, very sophisticated dog, and she's a papillon, and she's a queen, and she knows it too.
I met her.
So we take her to the park and we walk with her, and she gets very bothered when there are dog waste left on the ground.
I feel her. Yes, people should pick it up.
And she's very vocal, and she complained to me about it. So, and we also met a few homeless people in that park. The park is Udall Park here on the east side. Yeah. So when we were talking to them, and one of them told us her story on how she lost her home, and
it's heartbreaking.
Very hard. So, my husband said, why don't we, give these people some money every week and have them clean the parks around the town and, of dog waste, and they can wear our T-shirt. And if people ask who's sponsoring this, they can tell them about it, and they can give out some of the brochures or postcards. And, we can get the word out, and we'll be helpful to these two people to get off the street. And, well, long story short, they are off the street. They are now living in a home, and my Nala is walking in a park that's clean.
Oh, my goodness. That's phenomenal. Well, that's great. So not only you're helping people who need, home health, but now you're also getting in and dabbling into this community where it's a whole other ball of whatever you want to call it for homelessness here. But that is phenomenal that you're helping both. We need to talk about maybe how to make that larger, I think, a little bit more impactful. So you don't really have an ideal client. What does a typical client like you?
So anyone who needs the help. And sometimes, unfortunately, and this has happened personally to me, when 17 years ago, when my kids were just born and they were sick, and I didn't know what I was doing, because when you're a mom, you forget all the nursing training you've ever had in your life. And so anyone who is in a situation where they need the pair of eyes to look at them and to help them go through that difficulty. When you're dealing with health issues, when you're dealing with unbearable diagnoses, it's very difficult to go through it alone, physically, mentally, emotionally. And any of our clients that we have are those. Those are the ones that need our help. And sometimes it's our knowledge. Sometimes it's just to hold on, to hold their hand, and sometimes to just be there and be quiet, and sometimes to just say, okay, wait a minute, we're going to do this way.
There you go. And
sometimes we have doctors that are patients, sometimes we have nurses that are patients, and sometimes we have regular folks who don't know healthcare, and all of them need help sometimes. Yes.
What is, I guess, clients usually don't reach out to you, but what is the best way for a client to make sure that they get you if home health is needed, or how can they reach out to you to get the information requested?
So most of the way to get this service started for them would be through their doctor. Okay. And you ask the doctor. If the doctor thinks that you need home health, then you say, would you please request this Tucson Medical Home Health for me? And then the doctor reaches out. They can either call, email, or fax, and we'll go ahead and reach out to the patients or clients. And we have had some people calling in and asking questions and saying, I heard about you, and my neighbor had you, and I just wanted to see if you can help me. And we can do that too. We can reach out to the doctor for the patient and say, your patient reached out and this is what they wanted. Maybe you can meet with the patient and let us know if we can do anything.
Exactly. And nowadays you can do virtual meetings as well, which helps get things moving forward. So I just wanted to thank you so much for coming on the podcast. I have learned the difference between so many different types of nursing that I didn't realize when I started diving into exactly what it is you do. And you do a phenomenal job, you and your staff. And I'm sure the listeners have as well. Is there anything that we have not covered that you would like our listeners to know or Tucson to know?
I just would like to say that, community is a very important concept in Tucson. And that was one of the reasons we came here, because we wanted to get away from that impersonal Los Angeles that is so robotic that you don't even know anybody that you're sitting next to. But when we came to Tucson, we fell in love with the city because of that sense of community. And we want to continue that. We want to inspire people to do that, whether it's us doing home health or it's someone else doing hospice, someone else doing caregiving, daycare center, insurance business, anything. As long as we all do it as a community, we all help out each other, because at the end of the day, that's all it is. It's all about what can you do for each other. And we learned that lesson, I think, when COVID hit.
Yes.
That was the biggest lesson we learned. And I saw some communities that had tables set out in front of their houses with some free products, toilet papers and dishwashing
detergents and everything.
Yes, and so people would just go in and take it, and then they would put whatever they didn't need back on the table for the rest of the people. And so I think it's beautiful, and as a community, we have a better chance of thriving and becoming better as humans.
Especially if we come together. We all need to come together, I think, is one of the big things and big call-outs from what COVID did for us. It changed dramatically, I think, the way businesses do business. And Tucson, I call it a little big town because, yes, we are a large town, but they like to get to know who they're specifically dealing with before they start to make a decision. They have to feel good about you before they feel good about anything else. So
that's true.
I know. All right. Well, thank you again for coming on. I really hope you enjoyed the show. And like I said, I did learn a lot today. That is all for Connecting with Tucson with Jaime here at the Stewart Title Studios. If you like the show, let us know. You can connect with me or go to the Tucson Business Channel, a division of Mark Bishop Media, and you can connect with Dr. Kristin Makinajyan. I did it. I'm sorry.
That was great.
Via the web links that we'll have on the show as well. Just click on Connecting Tucson with Jaime Overturf, and you'll see all of her information there. As always, don't be afraid to step out of the comfort zone you make. Get outside that box. You never know where it might lead. Until next time, this is Jaime Overturf with Farmers Insurance. Keep on making unique connections, Tucson. Have a great day.